Well, in 2008, I had been looking at options for egg preservation because I was in a surgical residency and not able to take time out to either meet people and begin a relationship or preserve my eggs. So I met with Dr. Silber and we discussed the option of tissue preservation by removing the cortex of one of my ovaries and essentially stopping my biological clock for the period of time until I have the transplantation. And so I feel good that it was something that I was able to do. I think a lot of women don't know that this is an option for them. And it's always kind of an interesting discussion point when I meet women who have undergone difficulties with conceiving, because if I would have been able to do this at 25, there's no question that I would have done it. I hope that this becomes more widespread, more commonly available to women.
So when you were first told that you had cancer, what was the reaction of your oncologist when you wanted to be able to preserve your fertility?
Well, the oncologist at first was very hesitant. I think the diagnosis was already 3 weeks into the time I saw him, and he wanted to push me to get started on my chemo, but I told him that I didn't want to do that, that I wanted to have some time for fertility, and I really had to push him. He really wanted me to get started on chemo. He thought that it would delay things, and I said absolutely not. I think for me, I'm definitely, if I learn anything from this, at least going through MD Anderson, I think I am gonna try to push for them to be more proactive, for them to do this for their patients, especially the young patients, because to me, my goals are, yes, I have a career, but I'm also a woman and I want to be a mom.
MD Anderson is, I'm sure, the best cancer hospital in the entire world. I don't think anybody would question that. And even there, like it is all around the world, there seems to be a resistance to worrying about preserving your fertility.
But from the oncology point, he really didn't think that it was something of priority. So, and I don't know why that is.
So essentially, with MS, as we know, it's an autoimmune disease,
right.
And the theory goes that it's an ablation of your white cells, which is the problem. It's your white cells that are attacking the myelin sheaths that surround your nerves. The logic with this is it's an ablative therapy, so they're ablating the white cells, but they're leaving hopefully most of the rest of the red cells and platelets, so other things in the bone marrow. And with chemotherapy, and when there are no white cells left, they give you back your original stem cells. And your body picks up and recovers very quickly. It's obviously quite aggressive treatment, but the downsides, and of course there must be some, the main one being fertility. So the chemotherapy is very high doses, and it's ablative, meaning that it will, in all likelihood, render anyone kind of towards their late 20s, early 30s infertile. Absolutely menopausal.
Yeah.
So that would be a huge downside, of course, and may deter a lot of young women from doing this treatment. We then went on a wild mission to do all we possibly could to preserve my ovaries, and that's where you came to the rescue.
Did the doctors know about this?
No, they didn't know anything about it.
But you had this diagnosis made of cancer, Hodgkin's disease, so you have to explain to me, how did the diagnosis get made and what was your initial reaction?
Well, I went in with a heavy cough and a shortness of breath, and then they did a chest x-ray to determine that I had cancer. They had made that diagnosis after looking at the chest x-ray. It was an uncertainty, but he had a feeling that it was Hodgkin's lymphoma. There was a possibility that I could become infertile. So it was definitely a question I wanted to ask him the first meeting I had with him outside of being in the hospital.
So you really brought it up?
I did. Just excited to have this opportunity and ready to get it done.
I was diagnosed with severe aplastic anemia 3.5 years ago when I was only 25. And I've been married for almost 1.5 years now, and we desperately want children. And my doctors are searching for a bone marrow donor for me right now, and I know that having a transplant kills all of your eggs. So we are ensuring that we can hopefully have a baby someday, and it will give me major peace of mind and just make us feel better in every way, because we really want a family.
I mean, obviously, your rheumatologists, your oncologists are really smart. I know they're amongst the best in the country. I happen to know that. But they didn't warn you that you could preserve your fertility. Is that right?
Now, I read about it. When I got sick, I started reading all about aplastic anemia and transplants, and I found it online first that you can do that.
Basically, to make a long story short, they didn't give me much time to make up my mind on what I needed to do to preserve my fertility. Everything was being thrown at me all at once, that I had cancer, that I needed to look into preserving my fertility, that I needed to start chemo right away. The oncologist basically said that he wasn't going to give me enough time really to do what I thought I needed to do to preserve my fertility, that he wasn't going to risk my life. So with all that in my brain, I decided that it was best to go straight into chemotherapy and not focus so much on the preserving of the fertility.
And that was about a week he gave you?
About a week, yes.
And now you're finding out over a half a year later that all you really needed was 2 days.
Yes.
Because we could have just frozen your ovary, and 2 days later you could have undergone the treatment.
Correct.